Okay, so I want to show you some Merkel cell carcinoma examples here. Or actually, it's one example, but a couple of important stains to know, and we'll discuss some others. So here you see it almost looks inflammatory at low power. It's hard to tell, but it's so dense. And um, when you get on higher power, you'll be convinced that there's some type of neoplasm here composed of small, round blue cells. So when you go on higher power, you'll notice that they seem to be molding together in a sense. So they're just squished together and they're pushing up against each other. Um, there's Most of the cells have a prominent nucleoli that you can see. Others have more hyperchromatic nuclei, but for all intents and purposes, it looks to be some kind of dense neoplasm that's squeezing in between collagen fibers. Um, so you may have thought of a Merkel cell carcinoma based on the way that these cells are pushing together and molding together. That's one of the hallmarks on histopathology before you do the stains. But of course, you have to do the stains to help confirm it. So the most well-known discussed stain is going to be your cytokeratin 20 stain. So it highlights the neoplastic cells in a perinuclear fashion. So you can see a lot of these cells are staining brown on the outside of the nucleus. Sometimes you'll see a perinuclear dot pattern as well. So this is a very nice example of specific staining of the Merkel cells for CK20. In a lot of malignancies, you'll stain for CK20 and it'll just be pretty negative except for retained just some scattered Merkel cells. CK20 can be important in adnexal neoplasms because you'll have retained CK20 just as an aside in the retained Merkel cells, but it won't be diffusely positive like this. So diffuse positivity of CK20, you can start to think about a Merkel cell. And in your differential would be a small round blue cell, let's say a lung cancer that may have metastasized to the skin. So in that case, you want to do a TTF1, and the TTF1 stains will be negative in a primary Merkel cell carcinoma. So this is very nice and negative, so it helps to rule out metastatic lung cancer. So in addition to CK20, you're going to look for some neuroendocrine markers such as synaptophysin, chromogranin, neuron-specific enolase. There's a new stain out that's being well recognized called insulinoma like 1 protein or INSM1. So INSM1 can be positive in some cases of Merkel cell, even when the CK20 is negative. And there are some rare cases of Merkel cell where CK20 is negative. And the virus that you should be aware of that's associated with Merkel cell is a Polyoma virus. So not all of the tumors will be positive for Polyoma virus. And I think that if there's any suspicion of Polyoma virus positive or negative, that you can do specific molecular testing to make sure that you're not dealing with a Polyoma negative virus, which sometimes actually portends worse prognosis. So it's important to know if Polyoma virus is implicated in the Merkel cell carcinoma that you're dealing with. Typically, you'll do a lot more stains than this, but I'm just showing you the CK20 and the TTF1 for this example.